small intestinal bacterial overgrowth.
What exactly is SIBO?
Uninvited bacteria move in, like invasive weeds.
Why do some people develop this problem?
Causes can include certain medications, previous abdominal surgeries, diabetes-related nerve damage, or even structural problems like diverticular.
How do we test for SIBO?
Breath tests. Then you drink a sugary solution, typically glucose or lactulose. During the test, you blow into a hydrogen monitor.
So if we see a premature rise in hydrogen levels, we suspect bacterial overgrowth in the small bowel.
It's obviously crucially important to identify underlying causes for the bugs to inhabit foreign territory.
Speaking of treatment, what options do we have?
So the main approach is to treat the cause. Antibiotics like rifaximin help about half the patients. SIBO shouldn't be overlooked.
Hello all, and welcome back to the podcast that takes the complexity out of gut health, making it accessible and engaging for everyone, whether you're a patient, a student, a healthcare provider, or just curious. I'm Tim, and joining me again is our resident gut health expert, Professor Owen Epstein. Great to have you back, Prof.
Always good to chat, Tim. Today's topic, SIBO, small intestinal bacterial overgrowth. It's a really interesting topic because it's quite difficult for patients to understand that normal gut bacteria are mainly locked into the large intestine or colon, and that SIBO represents an invasion of the small intestine with uninvited bacterial interlopers.
Well, let's start simple. What exactly is SIBO?
Well, normally the small intestine is like a carefully tended garden, calm, balanced, and really designed to absorb nutrients efficiently without any disturbance. But in SIBO, uninvited bacteria move in, like invasive weeds. They spread quickly, disrupt the ecosystem, and begin fermenting nutrients meant for the body. This overgrowth leads to excessive gas, bloating, and discomfort, turning this once peaceful garden into a chaotic, overrun patch of ground.
So the small intestine should ideally be calm and balanced.
Exactly. It's not completely sterile, but it's certainly not meant to be crowded. SIBO throws off this careful balance.
And what symptoms would make someone suspect that they have SIBO?
Well, Tim, common symptoms are bloating and distension, often following a meal, and it's often accompanied by abdominal discomfort, excessive gas. Gas can be released top and bottom, and sometimes change in bowel habit, either diarrhoea or constipation. In more severe cases, people might even experience fatigue, unexplained weight loss, or nutrient deficiencies.
Why do some people develop this problem?
Good question. Usually something interferes with normal gut balance and movement, causing things to slow down. Imagine a river that normally flows smoothly. If something slows it down, water stagnates and algae start growing. Similarly, sluggish bowel transit creates the perfect environment for bacteria to multiply. Causes can include certain medications, previous abdominal surgeries, diabetes-related nerve damage, or even structural problems like diverticular.
Well, speaking of diverticular, could you explain what they are?
Yes, certainly. Diverticular are like little pockets or potholes that form along the intestinal wall, especially in the colon, but occasionally in the small bowel as well. Nutrients and bacteria can get stuck in these pockets, creating an ideal space for bacteria to thrive and potentially leading to SIBO.
Well, what else can cause a slowing down?
Well, a stricture or narrowing of the small intestine can cause a bottleneck. When cars slow down at a bottleneck, traffic jams happen. Similarly, food and bacteria can accumulate upstream of a narrowing, and this creates the conditions that are ideal for bacterial overgrowth.
How do we test for SIBO?
Well, Tim, ideally we'd like to directly sample the fluid in the small intestine, but that's very invasive. practically we use breath tests. They're safe, non-invasive, and simple.
How exactly can a breath test reveal if someone has bacterial overgrowth in their small intestine?
Well, it's a fascinating process. Think of your digestive system like a well-run factory where each department has its own job and timing. The large intestine or the colon is normally where most of the bacterial fermentation is designed to happen. And that's the designated fermentation zone. Now for the breath test, you fast overnight to clear the system. Then you drink a sugary solution, typically glucose or lactulose, and this acts like fermentable fuel dropped into the factory line. If all's well, that sugar should pass through the small intestine relatively untouched, only fermenting once it reaches the colon fermentation zone further down the line.
So?
Well, if bacteria have set up shop in the small intestine where they don't belong, they'll start fermenting that sugar prematurely. This is the early fermentation production that causes gases like hydrogen and methane. And here's the clever bit. That hydrogen behaves like smoke from a chimney. It gets absorbed into the bloodstream, carried to the lungs, and then you simply breathe it out. So during the test, you blow into a hydrogen monitor every 15 to 20 minutes, and the device picks up any hydrogen puffs that shouldn't be there yet.
So if we see a premature rise in hydrogen levels well before the sugar would have reached the colon's fermentation zone, we suspect bacterial overgrowth in the small bowel.
Yep. And it's really a very neat, non-invasive way of spotting a hidden problem just by measuring what comes out of your lungs.
Why are glucose and lactulose the sugars chosen for these tests?
Good question. Both glucose and lactulose are good for checking for SIBO. But they behave very differently in the gut, almost like two types of postal packages on a delivery route. Perhaps you can think of glucose as an express parcel delivery. Glucose is rapidly delivered to the small intestine, where it's picked up by the absorption in the first and early stretch of the small bowel, sort of like a courier who delivers a package right at the start of the delivery route. So if you start detecting hydrogen gas in the breath soon after drinking glucose, it means bacteria have hijacked that early part of the route and started fermenting the sugar before it's even had a chance to be absorbed. That strongly suggests bacterial overgrowth in the upper small intestine.
Got it. So what's different about lactulose?
Well, lactulose is more like a non-urgent delivery that travels the whole route without being delivered for pickup. It's a non-absorbable sugar that doesn't get absorbed anywhere along the small or large intestine. It just keeps going untouched. But when it reaches the colon, where the trillions of colonic bacteria are ready and waiting to feast and ferment, this is where the action occurs.
So, while humans can't absorb lactulose, bacteria have the machinery to feed off this sugar, and that's where, in all of us, you'd expect to see a natural rise in hydrogen on the breath test.
Yes, but here's the trick. If bacteria have crept into the small intestine, they'll start fermenting lactulose early, well before it gets to the colon. And that leads to an early hydrogen spike, an unexpected delivery, if you like, flagging that bacteria are present where they shouldn't be.
So in essence, glucose is great for spotting overgrowth in the upper part of the small intestine, while lactulose is best for detecting SIBO further down the small bowel.
Yes, but there is a caveat. While the lactulose test will pick up bacteria lower down the small intestine than glucose, the interpretation can be tricky. The question often arises, is the hydrogen peak derived from the bacteria in the small bowel, or is it just normal fermentation happening in the colon?
So unless you see a double peak, one for the small bowel and a second for the colonic fermentation, it can be difficult to differentiate.
Yes, correct. And current guidelines suggest that the glucose breath test is preferred due to its higher accuracy, especially when upper small bowel involvement is suspected. And lactulose is recommended and is probably more useful when considering more extensive or lower small bowel involvement, despite its interpretive challenges.
So once diagnosed, should we always look deeper to see why the SIBO has developed?
Definitely. It's obviously crucially important to identify underlying causes for the bugs to inhabit foreign territory. In fact, we would now recommend a capsule endoscopy, a small bowel capsule endoscopy, for all patients diagnosed with SIBO.
Interesting. So why is capsule endoscopy particularly useful for these patients?
Capsule endoscopy involves swallowing a tiny jelly bean-sized waterproof camera that takes video images of the inner small bowel as it travels naturally through the small intestine. It's invaluable because it helps detect structural issues that can predispose to SIBO.
Like?
Abnormalities like diverticular, strictures, or subtle signs of inflammation, such as Crohn's disease. And identifying these issues can lead to a targeted treatment and prevent recurrence.
Speaking of treatment, what options do we have?
Well, of course, the main approach is to treat the cause. However, while searching for the cause, it can be helpful to assess the effects of something called rifaximin. It's a non-absorbable antibiotic which acts locally in the gut with minimal side effects. Dietary changes like the low FODMAP diet that excludes certain sugars in the diet, such as lactose, fructose, inulin, and sorbitol, can also be tried.
To deprive the uninvited bacteria of their preferred diet of fermentable sugars.
Exactly. And in addition, there are medications like prucalopride that improve small intestinal motility, and this might be considered to stimulate the flow through the small bowel.
How effective are these treatments?
Well, antibiotics like rifaximin help about half the patients initially, but however, after the antibiotic wipeout, inevitably a new population of bacteria is likely to re-emerge, and SIBO will almost certainly recur if the underlying cause isn't addressed.
So seeking and managing the cause is fundamental. Are there any self-help tips that patients can follow to sustain better small bowel health?
Yes, as part of this more general discussion, the usual advice on small bowel well-being would be regular meals, stopping alcohol and cigarettes, as usual exercise, stress management, avoiding unnecessary antibiotics in particular, and perhaps limiting fermentable foods that can support, all these factors can support a healthier bowel.
To wrap it all up, Prof, what's your key message about SIBO?
SIBO shouldn't be overlooked in patients presenting with generalized IBS-type symptoms, and hydrogen breath testing is simple and safe. And although interpretation can be challenging, the test is very useful in detecting bacterial interlopers in the small bowel. Importantly, patients aren't imagining their symptoms. There's real biology at play. And identifying and treating underlying causes through thorough investigation, including perhaps capsule endoscopy, is crucial for seeking a lasting relief.
Thanks, Prof, for clarifying something which I thought was very complicated. Until next time.
It's always a pleasure, Tim. I look forward to meeting again.